Hi, my name's Jake. This is Alyssa. We're a neuromuscular therapist for cognitive effects, and today we're going to be discussing some soft tissue techniques to help with headaches and neck tension. Oftentimes with head injuries, we get cervical problems as well. Today we're going to address those. If at any time through any of these you feel pain or discomfort, we'll just have you stop. Okay. First, I'm going to have Alyssa rotate her legs facing this way. I'm going to have her bring her right hand over her left shoulder. So the areas that we're going to be focusing on right now will be the trapezius muscle. So the trapezius muscle is broken up into three regions: upper, middle, lower. We're going to focus on this middle trap because it helps a lot with rotation with the cervical region. So right now I'm going to have Alyssa search for any tender spots, any sore areas. Once her hand is in a good spot, I'm going to have her rotate to the right and left as her hand and fingertips are on that sore spot. Then I'm going to have her do either little circular motions or cross fiber or back and forth movements as she rotates. Then I'm going to have her keep her head in one position. So I'm going to have her keep it to the right. She's going to again find that spot again and then do a little bit of soft tissue work herself. Circular motions and cross fiber. Cross fiber is just going back and forth against the direction of the fibers in the muscle. Good. Then she can continue with the rotation again. Just a few more times. Good. Now she's going to search and find for another area that may be tender. Good. Then she's going to proceed and incorporate some rotation again and kind of repeat some of those same steps again. Rotate back and forth. Incorporate a little bit of cross fiber as she's moving. She's going to hold it in one spot and then continue with the cross fiber and circular motions. Good. After you finish with that left side, you can move over to the right side. So she's going to take her left arm and reach it onto her right trapezius mid muscle. If at any time your arms get sore through this, just take breaks. She's going to search for that tender sore area. Once she finds it, she's going to incorporate some movement while she's holding that area, and then incorporate a little bit of cross friction and circular motions on that area. Good. Good. Once you find it again, you're going to hold it in one position as you continue to work that area. And then incorporate the movement again, the rotation. Very good. And then relax. Then go back and search for another tender sore area. An important thing through doing any exercise or any movement, maintain steady breathing. Just want to make sure that we're getting proper oxygen as we're going through any exercise. So one thing to note as well, the speed of the rotation is to what you can handle, right? One thing, we don't want to be going super fast and rotating super fast. We just want nice, slow, consistent movement, putting that muscle through some of its range of motion as you're giving a little bit of soft tissue work to that area. So Alyssa's going nice and slow, nice and steady pace. You can also stop at any point throughout that motion, whether it's facing forward, whether it's off on like a 45-degree angle, or if it's all the way to your full rotation as you continue to work that area. After you've worked the trap area, we're going to move up to the suboccipital. That's where the base of your skull and your neck come up and meet. So I'm going to have Alyssa take her right hand I'm going to use her fingertips and going to try to find that suboccipital region. So first she's going to find that midline right in between those muscles up to her base of the skull. Then she's just going to go off to the right just a little bit. So you're going to be hitting a couple of different muscles in that region. You're going to be hitting the suboccipitals and attachments from trapezius and other muscles. All she's going to do is just do a little bit of cross fiber like we did before on the trap. After massaging it for a while, then you can move your head. So I'm going to have Alyssa move her head to the left just a little bit and then continue working that. Yep, holding it in that position, a little bit of cross fiber so you can massage that region while your head is in a different position, while that muscle is lengthened just a little bit. Good. Sometimes this area can be very sensitive, so go to the pressure that you can handle. If it's very light, that's okay. We want to just start drawing some attention to that area to start a process of healing and relaxing. And now we're going to move to the other side. So I'm going to have her take her left hand and left fingertips and find that spot one more time, finding the midline and then moving just lateral or just to the left and finding where all those muscles attach, the suboccipitals and the trapezius muscles right at the base of the skull. Again, she's just going to do a little bit of cross fiber, back and forth. You can also do some circular motions in that area. Another good point that we mentioned before is going to your tolerance level. Again, this can be a very sensitive region, so we want to go to what you can handle. Then I'm going to have her rotate her head to the right again, and just to massage that region just in a different position. This next region we're going to focus on is the TMJ, or temporomandibular joint. This region includes the chewing muscles and this temporalis muscle. We're going to focus on both of those. So the best way to find this region and massage these muscles, I'm going to have Alyssa bring her hands up towards her cheekbone. Then I'm going to have her work back towards her ear and then dropping just below that bone. Okay. You can clench a few times to make sure you can feel that muscle contract. Good. And then I'm actually going to have you have your mouth open just a little bit, so it's slightly ajar. So those muscles are a little relaxed. Again, with these regions, you're going to do a little bit of cross fiber and circular motions. The pressure, again, will be to what you can tolerate. Good. Right now, Alyssa's doing some good cross friction. Her mouth is slightly ajar, keeping those muscles relaxed as she massages them. Very good. After you feel like you've worked that area pretty good, we're going to move up just above that arch, that bone as you came down from, and we're going to work through this temporal region. So this muscle is pretty flat and covers a decent amount of space. So you can work up around your ear and actually go a little bit above your ear as well. Again, go to the pressure that you can handle. We don't want you to feel a lot of soreness after doing your own massage. Just bringing attention to these areas and massaging them will promote good healing and start your recovery. These are only a few of the many ways that we will approach to help you with your specialized recovery. Come visit our clinic and meet with our experienced multidisciplinary team to help you with your post-concussion syndrome.